Hello everyone, this morning I was reviewing some of the communication strategies and also information templates that we use in practice. And one of the ones that I use when I'm communicating to my patients is something that we talk about, the scale of health beliefs. And I thought I'd take people through that now because there are a lot of people at home who are quite stressed, quite nervous, particularly because it feels like for a lot of people this situation is sort of out of their control. Now I have a big question mark up the top because I want the viewers of this video to try and consider where they sit on this continuum of health beliefs as we go through them right now. So at the very top are symptomatic people, so people who believe that their symptoms are the best determinant of how their body is coming and going from a health perspective. Now, those people tend to always approach their health after the fact. Something happens to them, they get some symptoms, and then they'll go and address that. A great example of that right now might be the people who are continuing to flock to the beach. I saw yesterday an article again about people up in New South Wales doing that. They might feel fine for the next 5 or 6 days until they get a fever or a headache, if one of them happens to come down with coronavirus, and then they'll rush off to get care at that point in time. Obviously that's perhaps not the wisest way to try and live in the current climate. The next layer down is a functional perspective. The people who kind of exist in this belief system tend to understand that symptoms are generally connected to some kind of underlying issue within their body. And they will try and take actions to work on the underlying issues to eradicate the symptoms. And they may even go a little step further to try and take actions to prevent symptoms from occurring in the first place as well. These people still tend to think about the body from a symptomatic perspective, but are trying to offset that through taking better actions, and it has a bit of more of a preventative kind of idea attached to it. Now, the deepest layer of health belief that we talk about is performance. Now, what does performance mean? That means that people are taking actions to make sure that their body is expressing itself as well as it possibly can. So they make the best possible choices in order to try and have their body function at the highest level of health expression that's possible to their body. Now, the reasons that these people do that are to try and make sure that if they are faced with any challenge, they're in the best possible condition to try and deal with that. At the moment, there's some great deductive reasoning we can use to look at this. People who are most susceptible in our society right now, the elderly, the frail, the immunocompromised, people whose bodies are not performing at their best, are the ones that we're trying to help. They're the people who are most likely to suffer if they do come into contact with coronavirus. And sometimes people are contracting coronavirus and getting no symptoms or very minimal symptomatology because their body is obviously performing at a higher level. Now, why is this important? When it comes to control, right here exists in the lower two levels, and particularly the performance, the ability for people to try and control their outcomes to the best they can. So, are you eating well? Are you sleeping well? Are you connecting with people still? Are you moving? Because we're in isolation, our whole world, our whole rhythms have been upset and changed, and we have to adapt those. So I implore people to continue to think about this scale of health beliefs, where you sit, and can you bring yourself further down to the bottom and make better decisions every day to try and make sure that your body is performing at its best so that you can have some confidence and perhaps a little bit less fear attached to the current situation we're in. If you have any questions, please comment below. If you think this has been valuable, share this to all your contacts as well, because I'd love to keep getting the word out. I'm going to keep presenting more videos like this to try and help people stay educated and on top of their health and well-being through this period. Cheers.